First, let me apologize for the late start, but nevertheless, we are on our way. And I do hope that you will enjoy our presentation so far in relation to our open day. My name is Rodney Toppin, and I'm a nursing officer at the Student Health Clinic. And I'll be your master of ceremonies for this morning's occasion. To start, we will invite the Anglican chaplain, Dr. Michael Clark, to invite God's presence on this occasion. Dr. Clark, please stand.
Let us pray. Let us, as we gather here this morning, be mindful of God's call to wholeness in every aspect of our lives. Let's be mindful that in creation God revealed himself, and in so doing he declared that all was good, all was whole, all was well. Let's be mindful that God calls us to this wholeness, and he calls us to assist others in coming to wholeness. And so this day, as we gather to give God thanks for an institution that has given itself to creating wholeness in others, we want to thank God for all the work that has taken place over these years. We want to thank God for all those who had the vision to begin such work and to carry out such work, even when resources were few, but who saw the need and the importance of assisting to create atmospheres and environments of wholeness. We thank God for their years and their contribution. And we give God thanks for those who are currently involved in this work, who are recognizing the expanse of it and its extension in so many different areas, as we recognize the need for wellness in so many aspects of life. We pray that as we continue to explore new areas, that we may give them the same attention as we have in past areas and past times. We ask God's blessing and presence with us as an institution as a whole. And we pray, God, that he may give us the wisdom to respond to the needs of those who come to us, and to have the insight at times to reach out to those who are not aware of their own brokenness. That together, wholeness and wellness may be a priority on this campus and in our lives. We ask these things through Christ, who taught us to pray, Our Father, which art in heaven. Hallowed be thy name, thy kingdom come. Thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive them that trespass against us. And lead us not into temptation, but deliver us from evil. For thine is the kingdom, the power, and the glory, forever and ever. Amen.
Please be seated. Today, the Student Health Clinic celebrates 41 years anniversary, and it's in keeping with the University of the West Indies 50th anniversary celebration. And the theme for the Student Health Clinic celebration is Path to Prosperity, Think Well, Live Well, Be Well. At this time, we want to acknowledge the presence of our campus registrar, the assistant registrars, the deans, heads of departments, specially invited guests, staff both past and present especially of the UE Health Clinic, students, those persons who are mounting displays for us today, members of the Environmental Health, the HIV AIDS Commission, and to you, ladies and gentlemen. At this time, we want to invite our medical officer, Dr. J. Anthony Brandy, who's the head of our department, to give the welcome. Please welcome Dr. Brandy.
Mrs. Sandra Vaughan, the chair of the 41st anniversary celebration, Deputy Principal, Professor Eudine Barito, our campus registrar, Mrs. Jacqueline Wade, the assistant registrars, deans, heads of departments, specially invited guests, past staff and students, ladies and gentlemen. Good morning, everyone. Good morning. We are particularly pleased that you're able to join us in this celebration of our 41st anniversary of the Student Health Services, and apologize for the lateness of the invitations and also for the late start this morning. This ceremony was originally planned for last September, but it was agreed that it would be better placed this year as part of the 50th anniversary celebrations of the Cave Hill campus. Just over 41 years ago, in January 1972 to be exact, the clinic opened in 2 adjacent rooms on the ground floor of Sherlock Hall, with Nurse Beckles at the helm. As its first nurse, she was, in fact, literally the chief cook and bottle washer. The clinic was established primarily to cater to the health needs of the overseas students who lived in Sherlock Hall, which was the only hall on campus at that time. Since then, as demands grew, so did the clinic. In 2001, it was moved to its present location. I must add that with the growth of the campus and the increased number of students from 500 in 1972 to over 8,000 students now, we are already outgrowing our present capacity. 40 years is a good time as any to reflect on where we are coming from, to evaluate what we have achieved, and to chart a way forward. This is particularly important in light of the financial challenges with which we are now faced. Beginning in those early years with a limited staff of 1 nurse, who then referred students to doctors when necessary, opening hours for the clinic was 8:30 to 4:30. I don't think that evening classes were held in those days, but since then, with the introduction of evening students, the clinic hours are now extended to 9 p.m. At present, in addition to 4 support staff members, we now have 1 full-time doctor, 4 part-time doctors, a nurse administrator, 2 full-time and 3 part-time nurses, and a visiting psychiatrist and a psychological counselor. In addition to providing primary health care, which includes immunization for our students, the clinic has been involved in the provision of the STI HIV testing, support for the UE Games and the athletes who participate in them, and in the identification and facilitation of disabled students, to name a few of the things that we're involved with. Last year, a patient satisfaction survey was conducted to assist the staff to identify our strengths and challenges which are still to be addressed. Now, all of these things could not have been achieved without the support and generosity of others. The Deputy Principal, who chairs the Health and Medical Services Committee, continues to provide leadership and guidance, and we thank her for this. Thanks also to the Ministry of Health for not only their continued assistance to the campus in matters concerning primary care, but also for their involvement in the UWI Games of 2011 at Cave Hill campus, at which their public nurses volunteer their services. Emergency medical coverage for the Games was provided by the Queen Elizabeth Hospital through the Chief Medical Executive Officer, and a number of drug companies contributed medical supplies for the athletes, and we wish to thank them all. In 2011, the ministry was also instrumental in conducting an ongoing HIV/STI testing program for the students in conjunction with UWI-HOP. Additionally, through the assistance of the senior medical officer, our medical students are now able to get the special immunizations they require before entering clinical training. More recently, the ministry has also agreed to provide our athletes with the varicella vaccine required for their medical preparations for the UWI Games at Mona next month. The bursar will be pleased to note that thanks to the generosity of the Ministry of Health and our other sponsors, these things have been incurred with no additional cost to the university. I must mention that last year the health clinic was designated as one of the surveillance centers for communicable diseases as part of the Ministry of Health's monitoring program. Other departments and campus have also been instrumental in collaboration with the clinic in matters concerning our students' health and well-being, and we wish to acknowledge their ongoing contribution. And what of the future? As we look ahead, it is important to place a greater emphasis on novel and evidence-based approaches to addressing the health and wellness of our students, with an emphasis on prevention. Of note, obesity poses a major challenge to health, and it is of concern that so many of our young students fall in this category. Other undesirable lifestyle habits such as smoking, drug and alcohol abuse, poor diet, insufficient sleep, and lack of exercise all contribute to poor health. And these things we need to address in a more profound way. I'm also particularly distressed at the apparent increasing use of so-called study aid drugs by our students, especially during examination period. We are grateful not only for the support that we have received from those already mentioned, but also from our hard-working staff members over the years, who have all contributed to the growth of the health services. We are very grateful to Mrs. Pauline Beckles, the pioneer of the clinic, and hope that she is pleased to see its development thus far. With the exception of Mrs. Medford, Dr. Mayhe, Dr. Hines in the back there, who have served the health clinic for more than over 25 years, we are all relatively newcomers. Yours truly, having joined just under 3 years ago. We hope that when our turn comes to pass the baton, that we too will have made a positive contribution to the health and well-being of our students. But as we celebrate, we must also acknowledge the services of those who have passed on, Dr. Norris Prokop and Dr. Harold Ford, and more recently, Nurse Veronica Payne. Once again, I wish to welcome you and thank you for joining us in celebrating this, our 41st anniversary of the Student Health Clinic. Thank you.
I want to thank Dr. Brandy for that warm welcome. Moving on in our ceremony, which, as you know, we have our open day spans a whole. We have a whole day of activities planned for you. Later on, after the ceremony, we'll be having some poster displays in the clinic, as well as presentations by our various sponsors and our partners in health. At 2 o'clock this afternoon, we're going to have some line dancing for you, and we do encourage you to come and participate with us. And then this evening, we're going to revive it up a little bit. We're going to have some Zumba. So again, we want you to come and participate. As you know, we are very health focused, and we want you to shake those pounds when you have it lunch. Moving on in our program, we are going to kindly ask Professor Udine Barto, our Deputy Principal. We're going to invite her to the podium to give her remarks. Please welcome.
Mr. Rodney Toppin, Campus Registrar Mrs. Jacqueline Wade, Dean of the Faculty of Medical Sciences, Professor Brandy, stalwarts of the Student Health Clinic and Student Services, especially, as we have heard, its first nurse administrator, Sister Pauline Beckles, and her husband, Mr. Wilfred Beckles, who was not of the Student Health Clinic, but very much of the Cave Hill campus. Mr. Jaiba Singh, it is always a pleasure to see you back here. Colleagues, members of the campus community, nurses, environmental officers and staff of the Ministry of Health, specially invited guests, students, a blessed good morning to all of you. On behalf of the campus principal and Pro-Vice Chancellor, Professor Sir Hilary Beckles, I'm very delighted to invite you to this opening ceremony of the 41st anniversary celebrations of the Student Health Clinic. And as we noted from Dr. Brandy on the theme, Think Well, Live Well, Be Well. We are very pleased on the campus that the 41st anniversary is being observed and celebrated as part of the campus's 50th anniversary celebrations. And those celebrations are, the campus 50th anniversary celebrations are on the theme of the path to prosperity. Well, we all know that if you're very wealthy but you're not very healthy, that's a very poor subscription. So the first thing I'd like to invite you to do is join, as Mr. Toppin said, the Zumba class later today and be on the path to health so you can enjoy prosperity and good retirement. Sir Hilary sends his warmest congratulations and apologies for not being able to join us this morning. He's on an overseas assignment, otherwise he would have been here with us. The campus is extremely proud of the work undertaken by the medical officers and nursing staff, the entire staff of the Student Health Clinic, in offering the work they do to offer a package of medical and healthcare services to our 8,000 plus students. As Dr. Brandy has pointed out, the services have grown considerably from and also even just the facility, from the very tiny facility in Sherlock Hall. But it has kept faith with the energy, commitment, dedication, and caring skills personified by Nurse Beckles and all the early pioneers who were very involved in the delivery of the very first healthcare package of services. The schedule of services now include, and I'm thinking more in terms of the scheduling of time, as Dr. Brandy has pointed out, a full-time medical officer providing services assisted by the nursing staff during the hours of 9 to 5 p.m., Monday to Friday, and a panel of doctors providing services on a rotational basis to cover the hours 5 to 9 p.m. Our students also have access to general referral services, but also psychiatric and psychological counseling services. In collaboration with the UEHAP program and the neighboring polyclinics, and let me say that one of the things we are particularly proud of is the excellent working relations the Student Health Clinic has maintained and in fact continue to develop with the nurses and environmental officers and the staff of the Ministry of Health and the polyclinic, and I would say of the Queen Elizabeth Hospital too. But in relation to the specific point I was making, we were very pleased to introduce, on the initiative of UEHAP, but ably assisted by the Student Health Clinic and the nurses in the polyclinic, HIV testing for our students on the campus. We have had 2 sessions of that. I think it's 2 sessions. Mrs. Vaughn will 3 so far. Okay, 3 sessions, and there's a plan to expand it. And we found when this was offered that the students responded very positively. Additionally, and you will hear more of this again from Sister Vaughn, the clinic offers health education workshops for our students. In having our students experience a wider range of services and hours, we remain, and that is the campus remains committed to providing basic healthcare services to our students. So even as we expand in terms of education, what we are focusing on is the provision of basic primary healthcare services to our students. We know that there are challenges and usually of resources, and everyone knows that. However, the campus is very committed to upgrading the services in a variety of areas to cater to the growing and diversified student population. And we know that the medical officer has promised us some novel and enhanced basic services, so we look forward to hearing about that and to working very closely with her and her staff in terms of its delivery. But for now, we want to pause and give thanks and celebrate the work of the pioneers, all former staff members, and of course the excellent work currently being undertaken by the current staff. In our celebration, as Dr. Brandy reminded us, we also want to remember past staff members who have gone beyond, particularly our recently departed colleague and nurse, Mrs. Veronica Payne. We give thanks for her contribution to the clinic and her life. May she rest in peace, and all those who have served us in that capacity. In closing, on behalf of the campus principal and the senior management, we wish the clinic a very successful open day and a very successful 41st anniversary celebrations. Thank you all for coming to join us here this morning, and do enjoy the day. Thank you.
Thank you very much, Deputy Principal Professor Barito. Continuing our program, we're going to ask our nurse administrator, Mrs. Sandra Vaughn, to give us a review of the clinic's development through the years. So please welcome Nurse Administrator Sandra Vaughn.
A very good morning to all of you. We have observed protocol, and because of the length of time that it took for us to be here, I know that there are persons who've got commitments and so on. I would just like to, I wouldn't go through the entire review, but I would like to mention those persons. I would like to those persons who are here who have served the clinic over the years. I would like for them, I will call you, and I would like for you just to say to the group who you are and what you did in the clinic. I think that it is important that the persons who are present see you, know who you are. And I would like to start, as you say, the clinic started since 1972. There was quite a lot of discussion before that, since 1964, really. There was quite a lot of discussion. The other 2 campuses had already set up their health services, and there was a need. It was recognized there was a need for students to be seen on a regular basis. Most of the times the students were seen in an ad hoc emergency style, and persons anywhere on campus would call an ambulance or assist. And so having those discussions at the higher level office, it was decided that it was time that our students also had a structured health clinic. And having that in progress, Then at that time, it was the late Major Vincent Brown, who was the student counselor and warden at the time of the single hall, Sherlock Hall. And he had the privilege, I would say privilege, of being the head of that process. Our pioneer nurse, Mrs. Beckles, was then chosen to be the one to take that forward, and was then she then worked on setting up the clinic. Now, setting up from 1972, it was January of 1972, and setting up at that time, it took January to March before they actually started functioning, because there was so much, they were actually allocated empty rooms on Sherlock Hall, and that meant, as Mrs. Beckles says, that meant starting from scratch. So during that time, medical equipment had to be purchased, had to be sourced, medical supplies. Doctors were asked if they could serve the clinic, and Dr. Procope was the first doctor, the late Dr. Procope was the first doctor who came in and actually worked with the students from March. The process went on, and there was some development, and in 1983, there was need for expansion, and you would agree with me that, like in 1972, we had about 500 students intake, but then by 1983, that would have gone up into the thousands. So they needed to have some expansion. And there was a room in fact, a building identified where the clinic was set up just between the Student Guild and Sherlock Hall. And Mrs. Beckles and Oprah and Mrs. Nichols, they went over and they set up that. And during that time, we had Professor Emeritus Alvin Thompson at some point. He was in charge of the student health, the hall, and was in charge of the student health clinic. And then we went on to Mr. J. Jabbar Singh, was the director of the student services, and we moved through a number of persons who were in charge of the student health services and who supported the nurses during that time. What I would like to do at this point, having gone through that initial stage, we would look at those persons who are here from 1972 to present. Now, our nurse who is being recognized is Mrs. Pauline Beckles. I would like for her to stand so that you all can see her. Isn't she beautiful? Mrs. Beckles was at the clinic from 1972 to January until 2001. During that time, she did everything. Really, and she went through that process that I discussed about the setting up, the sourcing, identified so many resources out there so that she could bring things together and have a clinic. So that is why we are saying so much about her today. After that, we had another health sister, Mrs. Norma Nichols, and most people would have known Mrs. Nichols because she came in with Mrs. Beckles and worked along with her until Mrs. Beckles left in 2001. Mrs. Nichols took over as the senior health sister, and then she retired in 2009, and I took over. After that, in fact, within that period of time, Dr. George Mayhew, he took over from Dr. Sharp, who was also a consultant psychiatrist, because he recognized the need for the mental health well-being of the students here on campus. And with Dr. George Mayhew took over in 1975. So he is currently the longest serving person for the clinic who is yet present. That gave him 38 years. So far. And he's got a lot more to give to us. Oprah Medford is our clinic assistant. Oprah came through from 1984. She joined the clinic staff as the clinic attendant, and soon afterwards, in 1997, she was moved to the position of clinic assistant, and she has been serving in the clinic, doing everything at the front desk. She's receptionist, she's stenographer, she's a messenger, she is all that you can think of at the front desk. And I'm wondering how she makes it. But we really love Oprah and Oprah, or Pa. Right. And we really want to say how much we appreciate all that she does for us. We will have her to stand. Very shy lady. So she is currently serving for 29 years. Mrs. Nichols, who I spoke about earlier, she would have served for 26 years, from 1976 to 2009. Please do the maths. 33. Thank you so much. Just to give a little overview of what he does, because his aspect of it is so absolutely important to the students, to me.
Thank you very much, Sandra Vaughan. As you can see, I didn't come with any paper in my hand because I didn't come here to tell you anything special, other than, as mentioned, I have been here from 1975 officially. Why do you need a psychiatrist at a student health service? Because the students are not mad, and psychiatry and madness go together. And in any case, if a student misbehaves, you can call security and they can hold down the student. And even better yet, Jenkins is just down the road, so you can get them over there in no time. But fortunately, our students are in reasonably good mental health. They do not require psychiatric care as such. So my job is really more about trying to help to maintain good mental health for both the students and the staff. What has happened over the years, of course, is behavior patterns have changed. And sometimes when you walk on the campus and you see how students behave, you might say, they really need a psychiatrist up here. But I can assure you the behavior patterns I see on campus are within normal limits. For the year 2013, it might not have been for 1972, but it is okay now. I enjoy working at the Student Health Service. I have a good relationship with students and staff. As I tell students, I don't always agree with them, but I understand them. And we have a task in front of us, and that is that our students need advice. They come in here very young. They are intellectually sharp, but not necessarily matured. They're sometimes in doubt as to whether they're in the right department, when they should go on leave of absence, whether they should change faculty, so that we really need an advisory body that can help these students in their day-to-day management and coping, so that it is really all about mental health and not psychiatry per se. So we do not have disturbed students who need to have a sort of psychiatrist. But I get a lot of support and from the staff, and we are planning, as I spoke with Dr. Brandy, to set up programs to make sure that the students who need counseling and advice and so can get it, because there are a lot of students and they tend to demand quite a bit of time. So I would say that I enjoy being here, and I tell the students who I teach that when my memory gets as bad as theirs, I will give up the job. Thank you.
I'm sure you would agree with me that that was absolutely necessary. Well, at this point, I would like to just recognize those persons who are here, who came through the years with us. We have met our three important persons at the front, and now we will meet the other important persons who are sitting in the audience. Mr. J. Jabosing, can you? Jai, I am so sorry. Jai, can you please stand so that they can see you? And he was the director. He was the director of the Office of Student Services. Was there anything else that you, any other area?
It will take too long.
Thank you. Dr. Nayak, a very long time in the clinic too. Coming around the corner is Dr. Hines. Where's Dr. Hines? There you are. Dr. Hines, you served from 1979 to present. So he's still with us. Anyone else? Mrs. Sue? No? Oh, yes. Mr. Thompson, Professor Emeritus Alvin Thompson. Yes. Mrs. Thompson, Mrs. Harding. Is there anyone else? Right. You see the importance of it. It's so good to have them in the same room with us. You know, it makes you feel so special that they could have taken the time out to come here and just celebrate with us. And at this time, I would just like to use this time to give small tokens of appreciation to the longest working persons in the clinic. And from 1972 to 2001, Mr. Jai Jabosing will make that presentation to Mrs. Becker.
May I add something before I make the presentation? The best kept secret in the health clinic is the culinary skills of the nurses. Right? We used to have some beautiful lunches, okay?
It's wonderful to be here. Really wonderful. I can't believe 41 years have gone and I'm still here. Thank you. God is good. He is great. Now, I don't know if most of you know, 2 years ago I went into heart failure, so it is especially wonderful to be here. Thank you very much. I just want to say that I appreciate all that the senior members of the university, they had confidence enough in me years ago to invite me to the planning sessions of the clinic. And then this was in would have been 71. And later when they decided that they were going to go through the clinic, they asked me if I would be the nurse. I decided at that stage that it would be wise to say I could only work part-time because I wasn't sure if I tell you later that 8 months later, in August, I had a baby. So I knew that I might not have been able to cope full time. And I did, at that stage, I didn't think I should be telling anyone. It was too early to tell anyone anything. So that's why I came part-time at the beginning. My most important thing, I think, with the students, and I really appreciated them, was to explain to them that they were in the healthiest time of their lives. Because in those days, there were 18-year-olds and 17-year-olds coming. Not so much today, we didn't have so many mature students. We had really young students coming. And what I learned, too, about them was that, and I don't think we realize that a lot of the young people, even now, don't know as much as we think they do. Despite all the technology, there are lots of things, basic things, that we need still to teach them and to assume they don't know, and to really get to tell them. I impressed on them good health, not to be taking too much supplements. I didn't believe in supplements at all. And I also led by example, because I played tennis nonstop. Even in pregnancy, I played tennis nonstop. And when I went away on the inter-campus games, I was part of the tennis team. And to give you a little joke, even there, when they had the over 50s race, I said I didn't come back with a tennis medal, but I came out with an athletics medal. And I wore it proudly. I wore it proudly on the plane. And when we had the race, I ran, and I came third, so I came out with a bronze medal. Don't ask me how many people were in the race. Anyway, thanks a lot. I really had a wonderful time. The support of my wonderful husband. He has been there for me all through the years. Okay? I tell him all the time that when he was born, on the 14th of August, 1935, I was conceived specially for him 9 months later. So God was in it from the very beginning, and he still is, okay? And my children, I really appreciate them. Unfortunately, our baby died in 1972, the one he died. And, but I've had another one God sent specially afterwards, all right? So we have 3 children, a boy and 2 girls, and God is great. Okay, we've just celebrated 52 years of marriage, and 53 will come. Okay. And we're still in love. To Mrs. Vaughn and her team, keep going, and the students will really benefit. You're doing a great job. Thanks. I really feel privileged to be part of it.
Now we're going to invite Dr. Ronald Hines to come and present Dr. Mahy with his token of appreciation from the clinic. Now we're going to ask Miss Dale Lynch, our Acting Director of Student Services, the Office of Student Services, to accept this appreciation on behalf of Mrs. Norma Nichols, our health sister who retired.
I would just like to be able to say thank you on behalf of Norma Nichols. I think it's that she would be especially appreciative of the token and the acknowledgement of her contribution to the health clinic. And I just want to extend thank you on her behalf.
And at this time, I would like to recognize Mrs. Medford, and we will ask our deputy principal to make the presentation to Mrs. Medford. I wouldn't even ask her to say something. Should I? Offer? Come. No. Everybody's in your favor. She's a lovely lady, and we really appreciate having her work with us in the clinic. Okay, at this time now, I will hand over to the chairman, but we would want for you after the ceremony to come to the clinic and see the unveiling of a beautiful picture that is to remain in the clinic. It will grace our foyer with this picture. So immediately after this, we would like for you to come. Thank you very much. You have been a beautiful audience.